Hi, everyone. Our next special guest is Robin Lennon Deering. Hi, Robin. How are you?
John, I'm great.
So, what are your initial thoughts and feelings as a researcher, as a social worker, when you hear the term like data monitoring and evaluation as it relates to HIV prevention?
Well, when I hear that, the first thing I think as a social worker, and that impacts the way I see things. So I think that I would like to gather, information from as many multiple sources as I can. So my thoughts would be, how can I get information from, my peers, contacts with the local HIV service agencies, the research community, but most importantly, I would go directly to the community, the HIV community, to understand what they see, what they want, and what the solutions to whatever the problem or issue was from their viewpoint. And the reason that I know that that's really what would work is because my experience as a support group facilitator for 12 years is that people are experts on their own lives and they know what works for them. They know what they want, and they want to be able to participate in facilitating what works for them and for their peers. And so that's what I would start with. Who better to know what is good for them, and who better to know what's going to work than the person themselves who's living with that situation. So that's where the best place to start would be the person that is living with the situation. So I would go to that community, get as many different perspectives, talking to people that work with them, people that research them, go to the literature, but as many sources as you can, and then also the community.
And what are some approaches that you've taken to that may have been innovative, that may have been creative on collecting that data to involving the community?
Whenever I do plan programs or interventions, I always try to look for ways that I can bring people together. And so bringing people together in a way that they can, share and help each other. So the photo voice plan that I had was to bring people together and let them be able to tell their stories in a way that they could use the photos. They would be able to get these digital cameras, take pictures of different parts of their lives and share them with this small group. And once they had these pictures together, they could put them together in a poster of their stories and share what they wanted to share as to how they overcame adversity and what they were proud of, how they overcame challenges, how they overcame stigma, and then what they were proud of and what was important to them. And it was never anything that was related to material, financial, things that were concrete. It was always related to relationships, people, family. That was what was so important to them. And then, they thought I had them take photos of what they wanted their futures to be. And it was always what they could do for others. And so those photos and those posters, they were able to use in the community to share with the community as to what it was like from their perspective to live with HIV, and how they had these barriers, how they had these challenges, they overcame them. And then, they were able to turn around and help other people. So I think that that's one very innovative way of allowing people to use their expertise, their knowledge, and share some information in some ways that maybe they use some of their words, and some of their stories, but they can also use photos, which people can connect with. That I think is a way that people can share things that are, they go across all different socioeconomic layers, different cultural divisions, and people can really connect. So I think that was something that really was a successful approach to understanding the community.
Definitely. And I'm sure the women were empowered during this process as well.
Yes, they were, because they saw people that validated their stories. They saw the community members that were appreciative, that they were courageous enough to share, a piece of their journey, and willing to, expose their challenges, their successes, and also their dreams. And that's something that, not everyone is willing to do. So for them to do that was something that made them feel proud. And then
what advice do you, if a health department in the South would want to take something like this on, like what advice would you give health departments that may be looking for more innovative, non-traditional ways of gathering data?
Well, I would recommend that the employees that are very close to the community, that are very knowledgeable about, community members, that those are the ones that probably would be the best to take the lead on implementing something of this nature, because it's going to take relationships to build rapport, that people are willing to, commit to coming together and, trusting each other, trusting the person that's leading. One thing that I didn't mention is I did facilitate this photo voice group, but I had a co-facilitator, and the co-facilitator was a woman of color who was HIV positive, and she was an advocate in the community that almost every one of the women that attended knew. She worked in the community, and she was well known and well respected. And I was there as, maybe an expert on how to do photo voice and how to do, certain things. But she was there as, a leader of being a person of living with HIV, and helping, how to, become a person that can disclose, and a person that's able to, share their status in a way that is positive. So I would say, even having, if your person that is the employee is not HIV positive, even to have a peer that is HIV positive to be the co-facilitator, co-leader. Peers are really one of the best kept secrets of helping people that are living with HIV to, get the information that they need to, be inspired, to be helped, to get educated, all of that.
Because it's sometimes, especially in the South, the trust in the health department is low. So to have that community advocate, the community leader that everyone knows that they have endorsed this and they are a participant of it, is necessary in order to get participation, and true, genuine participation from the community.
Right. It's always better to have a leader from the community, or to cultivate those leaders. Sometimes people are just waiting to be asked, and are, when you ask them, I several times asked people that were, not necessarily people that were active, but I could tell that they were possibly willing to step up. And, when I asked them, they would. So it's like, don't feel if you don't have someone that because a lot of people I know in our community in the South are, they don't have a lot of financial resources. So if you're able to provide transportation for them, if you're able to, provide some stipend or incentive so that they're able to use their time to do something in a leadership role or provide some childcare for them. As a faculty member at a university, one of my resources is that I have students that take classes in the social work department who are looking to learn, how to work in the community and how to make a difference. And so I would, use that as a way of trying to build help as, maybe my students would like to volunteer to provide childcare to help with one of these events, or, anything that I could think of to help, bring forward or help the members that wanted to provide leadership, give them some resources.
Exactly, like addressing some of the social determinants of health, transportation,
Correct.
employment, stuff like that. And that's
helping them get skills and connections and helping them network, education. I mean, everyone has, hopes and dreams, and helping them to meet those. I even had, I'm invited my group members to come to my classes if they wanted to. All of these things, when you get to know someone and find out what their hopes and dreams are, it's easier to see where you can best connect them.
Thank you so much for this enlightening conversation.
Absolutely.
And your insight on innovative and creative ways of collecting data. I really appreciate it.
Absolutely. I've enjoyed it.
Thank you so much.